Are you looking for relevant healthcare information? Log on to Medicircle and watch experienced medical professionals talking on common healthcare topics. Stay informed, stay healthy, stay tuned to Medicircle.
We at Medicircle are constantly working on bringing to our audience all the trending health related topics. It is our primary objective to bring to your attention news and views you need to be aware of to lead a healthy, disease free life. To help us in this regard, we'd be joined by eminent and expert top doctors from across the country. Today in Doctor Speak, we are going to talk about homeopathy and how it works to help us. Hello, this is Aprajita Mehra, and you're watching Medicircle. Today on our Homeopathy Awareness Series, we have Dr. Jaswant Patil with us, an allopath turned homeopath. Dr. Jaswant Patil has over 30 years of rich medical experience. You are MBBS, MD Chest, and BHMS. He has treated more than 1 lakh patients using classical homeopathy. You are Chairman Deep Ganga Total Health Solutions Private Limited. Deep Ganga Foundation is a non-profit company for research in homeopathy and alternative therapies. He has also been lecturer in respiratory diseases at KEM Hospital, St. GS Medical College, Mumbai. He has worked as chief resident and in charge of intensive respiratory care at KEM Hospital and has also been associated with many hospitals of repute in his long and illustrious career. He has successfully treated many chronic cases. Presently, he is a member of the Maharashtra Ayush Task Force, received award at hands of Health Minister and ex-Chief Minister for exemplary work in COVID-19 serious cases as integration of homeopathy with allopathy. He has experience in working in ICU, ICCU, ITCU, general medicine, hematology, cardiology, pulmonology, and homeopathy. It is a privilege and pleasure both to be welcoming him today on Medicircle. So, hello, Dr. Jaswant Patil. How are you, sir?
Hello, I am very fine, Rita, and thanks for taking the interview and giving such a short and brief introduction. I'm really happy in doing this interview today.
Fantastic. So, moving quickly on our interview, my first question to you would be something very simple and something that you should be answering every day in your clinic. It is that does one have to take homeopathic medicines for a long time? The most common, conception about homeopathy that people have.
This is a very precise and very good question you have asked, and I hope that I would answer this judiciously and honestly. Homeopathic is a science that is based on the disturbance at the emotional level causing effect on the body's immunology, physiology, and the disturbance at the repair mechanisms, thereby causing a disease. So everywhere it is seen that once you address the central system, that is in classical homeopathy, and that is possible only in incurable cases. So there, if the information is correct from the patient and in total, and doctor, therefore it's called as science and art. It's a science because if medicines works to cure the disease, to control the disease,
Absolutely.
or to
Yes.
mitigate, or to put into the remission. But at the same time, it is a science that will take the all good information from the patient. So how good the patient is in giving information, how good art doctor has to take out the information. Now, if this information is total and complete, then one single remedy comes out, and that if you give, the patient gets well in the shortest possible time. Dr. Samuel Frederick Hahnemann, he was an MD allopath, and he said homeopathy is rapid, gentle. Gentle means no side effects. Huh? Rapid, gentle, and permanent restoration of the health. So in the shortest possible time. Now, shortest possible time, I have seen patients getting well in 1 week's time. So you cannot call that it is a slow acting medicine. But I've seen patients where the information is lacking. There it may take time for 1 year, 2 years, 3 months, 6 months, depending on how the information good is, and second factor, how fast his body is responding. That is a vital force. If it is good, I have seen results like in kidney stone pain, which is very severe. It's like a labor pain. I used to give as an allopath injection Baralgan to one patient. It used to take 15 to 20 minutes for a patient to get well. Here, Bavaris World, I used to put on a tongue and I used to see, you see how many seconds after your pain goes. And he used to tell 32 seconds, 35 seconds, 36 seconds. So within a minute, you used to get a relief. So this is the fastest acting because the medicine selection was very right. And if I would have selected a medicine which is not exactly fitting to the symptom, it would not have responded and the patient would have got well, or he would not have responded and then homeopathy is not working. So homeopathy never fails. The failure is on the part of remedy selection, the information given by the patient. So it is not at all a science where you take a long time. I have seen a case of CA esophagus with a report getting well in 3 months' time, and a common cold case where the information was lacking. There was some not proper follow-up from the patient, not proper following the principles of homeopathy. There, she took 3 years' time. So, the time cannot be specified. But when it is selected properly and the body's response is good, it is faster than allopathy. Secondly, I have seen that in allopathy, if you are into any chronic disease, like for diabetes, how long you have to take? Lifelong. Thyroid, lifelong. Hypertension, lifelong. Here in homeopathy, if the remedy fits in properly and works wonderfully, I've seen getting well in 3 months' time, 3 years, 3 years' time, that I usually tell to my patients. But I've seen the faster response whenever a patient is in the perfect state of vital force that is there. His information is correct. Doctor has understood what exactly the problem is, not of the disease, but why the disease in this person. So in allopathy, we treat disease in the person, whereas in homeopathy, we treat person in the disease. So you have to understand a person. If you understood person, it is the fastest giving relief in any of the chronic diseases, as well as in acute. So it is much more that I have seen. When the oxygen was dropping in COVID time, we give Carbovage 30, if it is an indicated remedy, within 10 minutes, the oxygen is to come to normal. So, see the faster action of this remedies. And therefore, I would say that homeopathy is definitely working faster and better, provided it is well selected and well fitting to the patient's symptoms. Thank you.
Right. So what I surmise from this long-winded answer is that the more clearer and precise the patient is about, the clarity that he has in his mind about what ails him exactly, if he is able to provide that to the doctor, that doctor would not misdiagnose it in any manner. And once the remedy is given, the short, solution to the problem is, of course, taken care of.
Right. Here, I would like to add one thing. The homeopathy is based on characteristic symptoms. The characteristic symptoms means if a person gets a fever, usually the appetite is lost. And patient says, doctor, mera fever jaisa padta hai. My fever increases, my appetite increases. I want to eat more. So these are the characteristics not seen in other patients common. So uncommon symptom, if the patient gives at the first thing, if the body is producing uncommon symptoms very rampantly, and that means his body's force is in a very well condition, these patients, they respond very fast to the homeopathic treatment. Thank you.
Moving on to another very interesting question that I have brought on board is, do homeopathic medicines have steroid doctors in them?
This is a common myth. As an allopath, also being a homeopath, some patients used to ask me, doctor, does homeopathy has got steroid? I say, who told you? Who told you that it is a steroid? I remember one of the doctor's family patient had come to me from Bihar, and I was treating her, and she was not gaining weight. And I had taken history what allopathic treatment she has taken. And everywhere the steroids, anabolic steroids, they were used. Even then, she was not gaining weight. And she started gaining weight after 5-6 years. And they say, oh, it contains steroid. So the doctor who had referred to me, she called me and said, doctor, your medicines has got steroids. I said, I cannot use steroids. I'm allopath. I'm licensed to give a steroid. Why the hell I should give in a suppressed form? It doesn't contain steroid. But a report has come as positive. I said, you just now fax me that report. Just now fax me the report, because I am for sure. I'm purchasing medicines from outside. I also want to know really does it have. I'll investigate into this, because for sure I know. I have come from allopathy to homeopathy because there I used to use steroids. Without steroid in allopathy, you cannot get results in chronic diseases.
Yes.
Not in all, but many. So I called, they didn't provide me anything. So I said that was a false allegation. Otherwise, they would have come back. Secondly, there are some cases happen. Now there are quacks. Quacks are there in all the sciences. Even if you see allopathy, you have a quacks practicing without any proper MBBS degree.
Absolutely, a compounder turns into a doctor very soon in a
Then even
background.
in Ayurveda and homeopathy also, you are finding quacks.
Yes.
Now, if they are using from there, someone would have accrued something. That is a different issue. But here, particularly in homeopathy, you know, if the pills are made from the milk sugar, lactate. Okay. So many times I thought, why some doctors report, they said it is containing this or this. So ideally speaking, if you want to have the real test, there were false positive tests in some cases where doctors were very reputed, and I was knowing that this doctor can never do this. So there are false positive tests also. Somebody might have experienced somewhere. So when it is experienced with a very standard reputed doctor, it is always a question mark. And no doctor in homeopathy. On the contrary, all homeopaths are against steroid. When the patient comes, firstly what he says, taper off the steroid and stop the steroids. Otherwise, you will not get action by homeopathy.
So that's the most primary statement that is given by any homeopathy.
All homeopaths say, then why the hell they will give you steroids? Okay. One argument I will accept, it has steroid. It doesn't have steroid. That the reason is that patient was already taking steroid, he is not responded. I told you a case which came to me, she was already taking steroids. So where are different steroids in homeopathy? Homeopathy medicine has no steroids, not even the medicines part. On the contrary, the side effects of steroids are treated very well by homeopathic medicines. So, you know, the biggest benefit I got of learning homeopathy was many times allopathic medicines are required. You cannot stop it. People are taking for years together, or there are some serious diseases. Allopathic science is not a bad science, but when it is overdosed or patient is oversensitive, he may get side effects and the bad effects of steroids. But steroids are needed. Otherwise, steroid is a life-saving thing.
So true.
Many life can be saved with the steroids. And there, if wherever I have used homeopathy, like in one COVID case where 60 milligrams of steroid was required to be given, I gave him 5 milligram because his CT score was more than 25, and I never wanted to take a risk. Because with homeopathy, if the information is correct, then the things will be different. So here, just with 5 milligrams steroid, no one will believe in allopathy. 5 milligrams of steroid only for 3 days, combined with homeopathy, and I got the best results. And the boy was okay. And only one case in 100, I have used steroid. But that is I've got a degree for using steroid, where to use and where not to use. And I told him, this is steroid, prescribing from the medical store. So he got a prescription. So when a doctor, I'm allopath, so I have got liberty to do that. Homeopath doesn't have that liberty. So he can refer to an allopathic doctor and ask that patient, if he is well versed with the allopathic doctor, the doctor, please give very minimum dose. I think with this combination, the steroid was required less, and he didn't suffer from the side effects of high steroid. uh, weakness, muscle weakness, as well as diabetes, and so many complications are there. So, this wonderful integration is a need of the time, and pandemic has given me an insight, and therefore I have done a lot of work on that. And finally, I could find out a way. So, the steroid is the biggest myth that is there about homeopathy. And a patient should directly ask a doctor. And if it is there, and if he has got any doubt, he can go to a laboratory and get it checked. And if there is, after that, there is something, doctor also has to see, because he is not manufacturing medicines at his home. He is getting it from market. But usually what is been done by powder forms are sometimes given. There you can have a doubt. So in a globule form, how can you mix a steroid in that globule form, which is already pre-factory produced? It is very difficult, impossible.
Yes.
And that too, the steroids are required in the milligrams, such a high doses. And that small will not make a difference. So there are so many explanations. And finally, the conclusion is that homeopathy does not have steroids. Homeopathy does not believe in steroid, and homeopathy is against steroid.
Naturally, now all our audience must have the complete clarity on this topic now that the doctor has explained it so well. Since doctor, the questions has already moved towards chronic diseases and patients suffering from them. My next question is, can patients suffering from diabetes take homeopathic medicines? Is it all right to use them side by side their long running medications that they're already taking from allopathic?
Yeah, definitely. On the contrary, they should take homeopathy along with diabetes for two reasons. But the globules, they are very sweet pills. So many people have fear that my sugar will increase. There are two types of pills, made from sugarcane and made from milk, lactose sugar. So if it is made from the lactose sugar, it does not harm the sugar levels. And many times, if you see fructose sugar, we give IV fructose without insulin. That rise would be a false, not the glucose one, which is harmful. So they are safest to be taken if they are produced from the milk sugar. Number one. Number two, when you use homeopathy along with the diabetic medicine that patient is taking from allopathy, you can certainly, if he's on insulin, the insulin comes down. And finally insulin is stopped, and there is only on allopathic medicines. In allopathic medicines, if he is on 3-4 type of diabetic drugs, we can bring it down and keep it to 1 or only half 40. And patient's sugars are controlled in incurable cases and incurable cases. But that does not come to homeopathy so fast, because usually who comes to homeopathy after 5-6 years? At the start, if they come, I have seen in cases where they've been not given any other medications, that in 3 to 6 months' time, their sugar disappears, and even the HB1AC that comes to less than 6. But here again, you have to keep a watch. You cannot declare that you're cured. Ideally speaking, I have to keep a watch on such patients for 2 to 3 years, doing their HB1AC, fasting and post-lunch sugar. And if it remains normal for 3 years without medications of homeopathy, after the sugar comes normal, medicine has to be stopped. Because there are chances of relapse. So in some cases, the relapse does not happen. But such type of response is seen in the very initial cases of diabetes, when they come in right time. They take proper medications and they try to solve their life problems along with the proper selection of homeopathy. And if that goes on again, there is no trauma in that person's life, the diabetes comes back. So again, you have to start the same remedies. And what new symptoms are there, then you have to change or add as a complementary medicines, follows well medicine. And then again, it is a trial. So in that particularly, it is a long. So in some cases where you get the medicines doses are reduced, insulin is stopped, minimum doses of allopathy would not give rise to side effects. And secondly, if you are in a curable state, that is frequency, I would say less than 1% I have seen in my practice. Not everyone gets cured like that. But there I have one cases where I have tried and I got a success. But before declaring that you are cured, for 3 years you have to do a follow-up regular checkup of the patient, and ideally would be 7 years follow-up, but no one follows for 7 years. So I say for 3 years at least you keep on checking sugar and this, and if you get back, you come back to me. So in diabetes, if you take homeopathy with allopathy, a lot of benefits. Secondly, some people just take homeopathy and don't take allopathy, and if the sugars are more than 200, they go into problems. There I would advise here is a time where there should be an integration. Every science is good. Allopathy is good, homeopathy is good, Ayurveda is good. You should know the judicious, reasonable, and proper integration of these sciences together to give the best results to your patient. Therefore, I learned all 117 alternative science. Why did I learn? Because I wanted to find a proper solution. No science, every science has got scope and limitation.
Certain limitations and certain, strengths
So you should understand. You should not be a fanatic of any science. Doctor is born to cure the sick.
Yes.
For what is good for my patient, even if it is, sometimes the blessings from some saints. That also we have seen that it is affecting how? Because their mind changes, their psychology changes, they become positive, and that positiveness in that patient will cure them regardless of what medicine you are giving or not giving.
So true. The willpower itself, exactly. You recover from everything.
Finally,
you have a strong willpower. Yes.
I would end with this question's answer is mind disturbed emotion and disturbed mind is the sole cause of all the diseases from common cold to cancer.
Very well said, doctor. Now that we have come to the end of the interview, my last question, since we have a doctor of repute of 30 years in practice and also an MBBS and BHMS both. So it is my privilege to ask this last one there. In what diseases or conditions homeopathic treatment you have understood that are more effective for people?
See, homeopathy never treats disease. Homeopathy treats the man in the disease. Now, what is man in the disease? Man in the disease is the disturbed emotional state, disturbed mental state, and disturbed physiology, disturbed immunology, and all this together giving characteristic symptoms. So let there be any disease from common cold to cancer. So almost all chronic diseases, as I have told many times, that how did I come to homeopathy? I was an intensivist for 5 years, my own nursing home intensive care unit. My mother was sick and she was finally on the verge of dying. And there was no time left. I've tried everything. Even we have imported medicine that time from London. But still she was not doing fine. And finally she was on a deterioration stage. And I was waiting just for the time to come that she will close her eyes and she will leave this earth for the heavenly abode. That time I had tears in my eyes and I told God that, oh God, I have worked so hard. I have got such a big knowledge of allopathy. I got my own nursing home and I have left my biggest appointment. I would have been head of the department in KEM if I would have stayed there. I was getting an appointment in the Hinduja hospital as head of the department at that time. I left everything. I came to a native to serve the people of my own native, as well as with intention of being with my mother. She always wanted to stay with me and she was not ready to come to Mumbai. So I was there and I was with the tears in my eyes. I saw just turn after praying a homeopathic book which was lying, and I was dead against homeopathy that time. And I was not believing homeopathy. So I took out and just opened a book. And I saw one remedy which was fitting in, but I was not knowing where to get these medicines from. So I contacted homeopaths. They said, sir, it makes serious condition, it will not work. But I said, I have no choice. She is dying anyway. Why not to try? So I got it from medical store from homeopathy. I gave one dose. 24 hours, she started stabilizing. 48 hours, all the gadgets of ICU was out. And 72 hours, she was moving in the room with asking for a food to eat. This marvelous recovery was a shock, surprise, and overwhelming experience for me. She lived for 12 years after that. But that was the point where I decided God tells someone to enter into there by giving some experience. Otherwise, I would not have been homeopath throughout my life. I was dead against homeopathy. I never used to believe this science. I say this is not a science, this is all placebo. But when I got this experience and I started learning homeopathy, then I took an admission to the BHMS college. I started practicing in my own nursing home, allopathy with homeopathy. I was seeing marvelous results by the integration in my OPD as well as in the ICU. And my indoors started going down. Where my indoors was always full, it started going down to only 1 or 2 admissions. I said, and OPD from 30, it increased to 150. I said, why this happened? OPD is increasing, indoor is going down. So I asked one asthma patient, you were always getting admitted last year 3 times. This year you didn't get admit 1 time. He used to say कि डॉक्टर जो मीठी मीठी गोली देते हो ना आप, मैं घर जाता तो मेरा चेस्ट एकदम क्लीन रहता है. And I always keep that with me. Whenever I get a trouble, I put in my on the tongue and I feel better. And this whole year 3, there was no exacerbation, no pumps required. Only 1 or 2 times in the whole of the year I would have taken the pump. Yeah. So this is a place where homeopathy works from the smallest disease to the serious disease to the cancer, and if it is properly integrated, and that knowledge a doctor should have. And that is what is the time where the big institutions should try to integrate. See, I'm blessed with the knowledge of allopathy and homeopathy, so I can do this. But I wish that all doctors get a training like this so that we can save many lives. Thank you.
Thank you so much for coming on our show today and sharing your valuable time and insights with us here at Medicircle. It was truly a pleasure having you on this show, and you have given tremendous insights into homeopathy in a manner which no other doctor would have. So thank you again, sir.